Thank you for joining today's webinar, Leveraging Essential Medical Eye Care Services. This webinar is brought to you by Premier Academy 360. Attend webinars like this one, or visit our content library and on-demand learning at learnacademy360.com. Please note, we will send out a post-webinar email to attendees with the recordings of this webinar and any handouts within the next 24 hours. Past recordings and handouts can be found at learnacademy360.com. Q&A will be provided at the end of this presentation. Please chat in your questions anytime during the presentation. We want to hear from you and continue to provide you with content you want. Please stick around after this webinar and answer our survey poll. And now it's my pleasure to introduce our speaker, Natasha Strickner. Over to you, Natasha.
Hello and welcome everyone. I'm Natasha Strickner, VSP's Medical Eye Care Product Manager. Thank you for joining me today. My goal is to provide you with resources applicable to your practice right now. Let's take a moment to address the current landscape. The CDC issued a public health reminder to prioritize urgent and emergency medical visits. The AOA responded in support of these patient care guidelines, asking doctors of optometry to limit access to routine eye care and remain accessible to patients who have urgent eye care needs. In support of these guidelines, VSP is temporarily offering our medical eye care product, Primary Eye Care, to all insured members through May 31st. What is considered essential medical eye care? Services include, but are not limited to, sudden vision changes or vision loss, eye injury or trauma, conjunctivitis, foreign body removal, and contact lens-related pain, redness, discharge, or sensitivity. During today's webinar, we will cover what is VSP's Primary Eye Care Plan, how to obtain an authorization and bill for services, and highlight services that can be billed remotely. We will also have question and answers, so remember if you have questions, please use the chat feature and we will leave time at the end to address them. So what is VSP's Primary Eye Care Plan? VSP's Primary Eye Care Plan provides supplemental medical eye care services for the detection, treatment, and management of ocular and visual conditions. The patient's health insurance carrier should be billed as primary when other coverage exists and you participate on the health plan's network. Examples of essential medical eye care services covered by VSP's Primary Eye Care Plan include eye trauma, eye injury, conjunctivitis and pink eye, foreign body removal, and exams and tests to diagnose sudden changes in vision. For a complete list of covered services and diagnosis codes, please refer to VSP's Primary Eye Care Plan Provider Reference Manual on VSP online at eyefinity.com. Now that you know what Primary Eye Care Plan is, how can you leverage it to help you support your practice during the COVID-19 pandemic? VSP extended Primary Eye Care Plan services to provide greater access to care, allowing 57 million members the ability to receive services from their VSP doctor, who knows their eyes best. That's a total of 74 million members with access to you. When a patient sees a VSP doctor for essential medical eye care, this can help alleviate the current strains on the U.S. healthcare system due to COVID-19. This also helps to create additional revenue stream as routine exam services are limited. Which members have access to essential medical eye care? All insured VSP members, including MetLife and Cigna. Discount plans such as Access or Vision Savings Pass is excluded. Let's go over how to obtain an authorization for services. To confirm primary eye care coverage on Eyefinity, navigate to the e-insurance tab. Enter the member's ID and access the coverage summary page. Select the Show Radio button for primary eye care. Next, select Yes to authorize the benefit. You can now complete the CMS 1500 form and submit the claim to VSP. You can also confirm primary eye care plan eligibility on the patient record report or the VSP plan summary. If you do not see primary eye care coverage within the patient record report or through Eyefinity, please call VSP Customer Care to obtain an authorization for temporary medical eye care services. Here are some important tips for billing primary eye care. Primary eye care is supplemental to medical insurance. You should bill medical insurance as primary when you participate on the panel. A standard $20 copay applies to exam services only, and a medical diagnosis must be billed in the primary position. Telemedicine refers to the exchange of medical information from one site to another through electronic communication to improve a patient's health. I'm sure many of you are familiar with CMS 1135 Waiver Authority, which expanded capabilities and reimbursement for telehealth on a temporary and emergency basis. During the pandemic, individuals can use commonly available interactive apps to visit with their provider. Any technology with audio and video can be used. Patient consent is required and must be documented. The services performed must meet evaluation and document criteria based on the CPT code billed. Billing criteria varies by insurance carrier. VSP's primary eye care plan covers the following services that can be billed remotely or from a distant site: evaluation and management services, remote retinal imaging services, digital evaluation management services, and interprofessional internet consultations. What is the reimbursement for primary eye care? Reimbursement for non-Medicaid eye exams will meet your signature plan payable fees. Remember, refraction is not a covered service under primary eye care, and additional services are reimbursed at 80% of your usual and customary fee up to the VSP primary eye care maximum allowable. I hope you found this information helpful, and now we'd like to open it up for questions. I'm joined by my esteemed colleagues, Kurt Kleiner and Sam Ramirez. Kim, do you have some questions for us?
Yes, thank you so much, Natasha. The first question is, what are the primary eye care reimbursement rates? And Kirk, if you're trying to answer and you're on mute, please, there you go.
Yeah, okay, thank you. Hi, I'm Kirk Kleiner. I'm VSP's Reimbursement Program Manager. So the reimbursement rates for primary eye care, for the exams, those would be, as the slide mentioned, your signature exam payables. Those would include the 920 codes and the 992 codes. For the non-exam codes, reimbursement is virtually the same as CMS, so you can go on to cms.gov and you can use the physician's lookup tool to pull up the reimbursement for your payment region.
Great. Thank you. We have a lot of questions coming in. This is a very hot topic. Next question is, what is the maximum allowable?
The maximum allowable. Okay, thank you. This is Kirk again. Yeah, the maximum allowable is the most that we would reimburse for a particular service. So, it's similar to billing for routine services. We assign reimbursement for exams and dispensing. For primary eye care, it's similar. We're going to have assigned reimbursement on the exams, and you can find out those amounts by going to Eyefinity and looking at the e-insurance at VSP.com, and you can look at your assigned fee report. To look at those non-Medicaid maximum allowables, you would want to go on to cms.gov and use the physician fee lookup tool.
Great, thank you. And the next question, Natasha, can you please pull up the telemedicine code slide once again? That was the question. Thank you. We'll leave that there, and I'll go on to the next question. Do you have any recommended telemedicine apps?
This is Sam. VSP actually does not recommend apps or technology, so you'd want to go ahead and just consult with your peers and perhaps see what they're using. But at this time, CMS and VSP were not recommending technologies.
Thank you. And next question, does PEC not cover G2012 during this time? I thought that it did.
That is not a currently covered service under primary eye care. For a complete list, please refer to the VSP Primary Eye Care Manual on Eyefinity.com.
Thank you. Next question, can out-of-network doctors bill VSP for patients with out-of-network coverage for primary eye care?
Out-of-network is typically not covered under primary eye care. If there were any questions about that, you could always contact customer service, and they would review the benefits with any doctors who have questions.
Thank you. Our office is currently closed, but taking emergency calls only. If we have an emergency, can we bill? Excuse me, sorry, I'm having some technical difficulties on this side. Can we bill after hours visits, even if during the hours we would normally work?
There are some after-hour visits covered by primary eye care, so please again refer to the covered list of services in the primary eye care plan provider reference manual on VSP online at eyefinity.com. All services are reported and outlined in that resource guide.
Thank you. That's great. For telemedicine exams, how is visual acuity best taken? And must it be taken in order to bill under primary eye care?
For telemedicine services, we can't recommend one type of visual test over another. However, you'd want to make sure that you're meeting all of the criteria outlined for the particular CPT code that you are wanting to bill for, and whether or not that requires an acuity test. We do only cover at this time medical eye care services. We would not cover routine well-vision eye exams through telemedicine or refraction.
Thank you. Oh, thank you. Sorry. Do you have a link for the primary eye care can you help direct folks to the primary eye care manual, please?
So on Eyefinity.com, under VSP Online, there should be a list of plans and coverage. And so in the list of in the provider reference manual, they'll say primary eye care plan, and click that link, and it will have all the information related to primary eye care. I will double check and see if there's a way that we can send that in the post information that will be sent out.
Thank you. Can you clarify what types of services VSP covers using telemedicine?
Certainly. We cover medical eye care related services in order to help triage a patient and do that evaluation without that face-to-face interaction. The PowerPoint is still showing the CPT codes that are currently covered. So it's the evaluation management, remote imaging, digital evaluation management, and those were recently added effective April 1st, and then also the interprofessional internet consultation codes. Those are also identified and listed in the primary eye care plan detail pages in the provider reference manual. So there's additional details there as well.
Thank you. And really quick announcement on this recording and content just for those listening. We will send out a recap within 24 hours with this recording and any handouts after this webinar. The next question, are VSP members on Medicare Advantage plans such as alignment included in the primary eye care coverage add-on?
Kim, can you repeat that question one more time?
Sure. Are VSP members on Medicare Advantage plans such as an alignment included in this primary eye care coverage add-on?
Perfect, thank you. I just want to make sure I heard all the details. Yes, so all insured members, VSP members, have access to primary eye care at least until May 31st if their current coverage does not have the benefit. And again, if you need help checking coverage or eligibility for your member, please reach out to customer service. All of our customer service representatives are happy to help you in confirming that eligibility.
Thank you. We have this question. If you're aware, I'm not sure that this can be answered here, but are you aware of if anyone else who is closed other than emergencies, if they are making exceptions for first responders or essential employees?
Kim, is there a way that we can, oh, go ahead.
Mm-hmm. Go ahead. I just thought maybe you didn't hear the question.
No, I was just going to say I don't have that information available.
Okay.
So maybe if there's a way to follow up after the presentation, we could maybe email that to academy360@vsp.com and we could follow up.
Yep. Please shoot us your email for that one. And then the next question, if I'm billing the patient's medical insurance as primary, and they have not met their deductible, will the primary eye care coverage cover the patient's portion applied to their deductible?
So when it comes to the primary eye care and coordinating benefits, yes, we can coordinate as a secondary payer, so you would definitely want to submit that to the primary plan, allow it to be applied to their deductible, and then send VSP the copy of the claim with the explanation of payment, and we will coordinate up to our payables for that patient to help them maximize their benefit, as long as they're covered services. And again, those services that we cover are in the provider reference manual for primary eye care.
And just a clarifying comment on that, thank you, Sam. That's exactly correct. VSP would not pay more than we would if we were the primary payer.
Thank you.
Correct.
Can you, the next question is, I thought access and discount plans were not eligible. Are they temporarily eligible?
Great question. Currently, the discount, the access and vision savings pass plans are excluded.
Thank you. And if I'm billing the patient's medical insurance as, oh, sorry, that one I already read. For remote evaluation, code 92227 and 92228, do we need to try to get a copy or record the, or record the photo from the patient?
You have, in order to bill those particular CPT codes, you'd have to make sure that you're following all of the guidelines for servicing, recording documentation as you would, and any images or videos that you obtain through telemedicine, those do need to be documented and stored.
Thank you. Let's see. So no members are encouraged to use their existing VSP vision plan coverage for glasses and contacts. Can you tell us if, oh, sorry, that was read incorrectly. Does VSP primary eye care plan include glasses and contacts? And it looks like they're asking if there's clarity around that. Sorry, this one's a little hard to get what that was being asked. I apologize.
So if the question is, does the VSP primary eye care plan include glasses or contacts? The answer is no. Members are encouraged to use their existing VSP plan for glasses and contacts if available under an urgent or emergency situation.
Great, thank you. And that concludes our time for questions today. Shortly, you'll see first of all, I want to thank our speakers. Thank you panel, thank you Natasha for bringing us this valuable information. Also, recordings and any handouts can be found at learnacademy360.com. So we can continue to provide content you want. Also, check out learnacademy360.com and register for our upcoming webinars, such as It's All About Trust with HR expert Megan McCarthy, Stop the Gossip with HR expert Megan McCarthy, and look for our live COPE CE hours coming at the end of this month.